Welcome back. This should be the last 20 minutes or so of your first week of hybrid lecture. So thank you for going through it with me. We're gonna find ways to split this up so that you're not stuck with a 2-hour long video for lecture. So we'll pick up where we left off. So other therapeutic service careers. Okay, so an occupational therapist, they specialize with activities of daily living, which is abbreviated as ADL. Okay, these are things that you need in order to live a normal life. Like you need to be able to feed yourself. You need to be able to brush your teeth, brush your hair, right? So these are things that you should be able to do to be independent, live a normal life. Okay, so they generally work under the direction of a physician that specializes in rehab and physical medicine, and then they try to use their treatment to make sure that their patients, if they've lost some sort of ability, like from a stroke, or some other kind of disease or disabilities, they try and get them to lead as normal and productive a life as they're able to. Then you have the occupational therapy assistants, or OTAs. They work under the occupational therapist. When the occupational therapist says, hey, you should do these exercises and you need to do X number of them, and so many times, it's the occupational therapy assistant that carries that out. Okay, so that's going to be very similar to the physical therapist and the physical therapy assistant. So the physical therapist, they look at treatments for joint, bone, muscle, and nerve injuries or diseases. So they use exercise, massage, and then like heat, cold, electricity, ultrasound, to be able to treat these injuries or diseases. And they build a treatment program. So it's this treatment program where they decide what exercises would be best for the patient. Say you want to do 15 side steps each way, and they need to do it 3 times. It's that physical therapy assistant that helps carry those out and walks the patient through them step by step. All right, let's go back to the pharmacist. The pharmacist dispenses medications. They also deal with physician's handwriting, for one, but they provide information to patients regarding the medications that they are prescribed. Maybe make sure that they're not going to have any bad interactions with any other medications that they're taking, or maybe they shouldn't eat things like grapefruit or drink grapefruit juice when they take that medication, something like that. So they need to have a very good depth of knowledge on medications. Pharmacists have what's called a PharmD education. This is a doctorate in pharmacy. Okay. They need to be able to recommend non-prescription items to customers. So if you have a cold, what sort of cold medication might work best for you, depending on what's going on. They help maintain records on medications that are dispensed. There's a lot of regulations and laws around opiates and soma drugs, that sort of thing, that they have to keep track of, and they have to count every single pill. Okay. What's really cool about pharmacists is they can own and run their own pharmacy, right? So they can be an entrepreneur, or they could also work for another company like Walgreens or CVS or Target and work for someone else, right? Then you have the pharmacy technician. They work under the observance of the pharmacist, and they they help prepare the medications to be dispensed. They label the medications. They help do inventories on the supplies and the medications that they have in stock. They can prepare intravenous solutions and help maintain records. Okay, pharmacy technician. That is an HSTE level certificate, and you can become registered for that as well, and you'll make more money. I'm going to skip ahead to respiratory therapist because a recreational therapy assistant basically carries out what the respiratory therapist, has recommended. The respiratory therapist, oh my goodness, recreational therapist oversees the recreational therapy assistant. They carry out the day-to-day activities with the patients directly. Now, on to respiratory, which is breathing. Okay, that's separate. So there's different levels in respiratory therapy. So you have an RT. Generally, they're going to have at least a bachelor's to a master's. They work under supervision of radiologists. It's late. It's late. This is what happens. So they work under a physician, excuse me. So they can treat heart and lung diseases with oxygen, gases, medications like albuterol. They monitor ventilators, and then they also do some diagnostic respiratory tests. Then the respiratory therapy technicians, this can be an HSTE or an associate's degree. They can administer respiratory treatments, do basic tests, and then they also monitor patients and report their progress. Now, a speech language therapist can also be called a speech language pathologist. So they evaluate and treat speech and language disorders. Okay, this is when people cannot formulate language through some sort of impairment, like they're unable to vocalize things or make sound. They're unable to form their mouth to create effective speech. And they kind of help treat and teach them to cope with these problems. Then you have a pathologist. Audiologist. So, audio means hearing, right? So, you have car audio. That's what you hear and listen to in your car. So, audiologists are specialists that work with patients who have hearing impairments. So, they test hearing. They diagnose any problems that patients may have in regards to their hearing. And then sometimes they provide treatment like hearing aids, auditory training, or speech or lip reading. Then you have surgical technician or technologist. This is an associate's degree or an HSTE program. And they generally help out with a physician or a nurse when a patient is in surgery or preparing for surgery. They set up the operating room with instruments, equipment. They make sure everything is sterile. And then they also assist the surgeon by passing them instruments during the surgery. Then we have the art, music, or dance therapist, and they help patients deal with any sort of emotional or social or physical problem that they have to help promote physical and mental wellness by using art, music, and dance. Next, we have an athletic trainer or an AT. So they help prevent and treat athletic injuries. So they help provide rehab services to athletes and they specialize with sports medicine. They teach proper nutrition and give specific advice on how to gear a physical conditioning program to increase strength. They can apply tape or padding to protect certain body parts. They treat minor injuries. They can administer first aid. Uh, and then they can also provide emotional support for the patient, especially if they've lost some form of function. Then you have a dialysis tech. Dialysis technicians, they're also called a renal dialysis technician or hemodialysis technician or nephrology technician. All basically refer to the kidneys. Okay, so they specifically operate kidney hemodialysis machines, and they have to monitor these patients during that process. And they also have to teach proper nutrition for a restricted diet for a patient on dialysis. Fun fact, a banana has enough potassium in it to kill you. So that doesn't normally kill people because people eat whole bananas all the time and they're fine and they're healthy and it's great for them. But if their kidneys were not functioning properly and could not filter that extra potassium out, that could cause their heart to beat irregularly and they could die from it. So a banana could potentially be hazardous, and these dialysis technicians need to be able to advise the patients on specific diet needs for that. Next is the perfusionist. So certified clinical perfusionist or extracorporeal circulation technologist. So these are the people that focus on a heart-lung machine during open heart surgeries. So they make sure they look at the blood gases and vital signs, and then they help induce hypothermia, which is a lower body temperature during surgery as well. Okay, we're going to finish up with diagnostic service careers. So I'm going to kind of start from the bottom and work my way up on this slide. The electroencephalographic technologist, also known as an EEG tech, they're the ones that specialize in looking at the electric functionality of the brain. Okay, so electro is electricity, encephalo is inside the head, and graphic is to take a picture, right, or to record. They're the ones that put the electrodes on your head during a sleep study. So they can also be combined with an electrocardiograph tech, an ECG technician. Now, the difference is the electrocardiograph looks at the electrical activity of the heart, whereas the EEG tech looks at the electrical activity of the brain. So they look at similar things, and it's a similar skill, so sometimes those two jobs are combined. Then you have a registered diagnostic vascular technologist, so these are very similar to the cardiovascular technologist. So they can perform stress tests, Holter monitorings. They can do thallium scans, okay, where they inject you with thallium, and then it's a nuclear scan where they track it through the body. They can assist with cardiac catheterization procedures. Okay, that's where they stick a catheter or a tube into the cardiovascular system, and they can perform tests or treatments through that catheter or tube. They can do an angioplasty, which is where they remove blockages in the blood vessels, and they work alongside cardiologists with all of this. Right, the electroneurodiagnostic technologist. So this is going to take that EEG tech, that electroencephalograph technician, and it takes it up to a next level. So they have the advanced EEG training where they can perform nerve conduction tests, where they stick a subdermal needle under your skin and hit the patient with a little shock of electricity, and they measure the amount of time it takes from when they deliver the shock to when it goes to the brain and comes back and tells that muscle um, to contract. Okay. Um, and then they can measure specific responses to stimuli, do EP or evoked potential tests, um, and they can also um, administer sleep disorder evaluations. Okay. Now we're going to get into our medical or clinical lab technician and assistant. Now, the technologist, it's just what it says. It's at least a bachelor's level or higher of education. They can do the most amount of tests. Um, they can supervise technicians and assistants. The technician has the equivalent of an associate's degree, can't do as many things as the technologist, and the assistant basically does specific tests under the supervision of a technologist. Um, so they can do um, biochemistry, blood bank technology tests, cytotechnology tests, hematology tests, molecular biology, histology, which is the study of human cells and tissues, and also microbiology. Okay. Um, when we get to the phlebotomists, they specialize in drawing blood, making sure that the right vials are used for blood depending on which tests are ordered. Um, Okay, so that's an HSTE education level as well. The radiologic technologist, okay, an RT, they work under the supervision of a radiologist. Um, they work with x-rays, nuclear medicine like PET scans, ultrasounds, MRIs, and then they help take the images and recordings that help the radiologist do diagnostics. Um, so, like I said, they do MRI, PET scans, CTs, X-rays, all that fun stuff. Um, all right, so we're gonna stop here. We'll pick up the rest on the next video, um, but this should be the end of your 2 hours for your attendance for the week. So I apologize it's so late in the week that's been posted, but I will be ahead of schedule next week for the remainder of the semester of class. So again, any questions, email me, Barton, BARTONJ, at dearbornschools.org. You have a massage therapist. Massage therapists generally work under the supervision of a physician or a physical therapist, and they use massage and body work and therapeutic touch to the muscles of the body in order to provide some sort of pain relief. They can also improve lymphatic circulation to help decrease edema. Edema is swelling or fluid retention in your body, where your body is holding too much fluid. Okay. Um, Massage therapists help relieve stress and tension. And then some of them are entrepreneurs, where they own their own clinic or business. And it generally takes about a year or so to get your massage therapist certificate and license. Then we have recreational therapists. So those use recreational and leisure activities as a form of treatment to minimize patients' physical, emotional, and mental symptoms. Okay, so this could be dancing, arts and crafts, musical activities, maybe reading a book, going on field trips, what have you. Okay. And the whole point is to be able to get the patient to be more independent, build self confidence, relieve anxiety. Um, and then some recreational therapists do have their own clinics. All right.